Hello everyone, and welcome to the Health Go Live webinar series. Today's episode is brought to you by our friends at Orbita. Just a few housekeeping items to go over. We would like to remind everyone that the Q&A feature will be available, so feel free to send in those questions for the panelists throughout the discussion. And stay tuned after the webinar for Harrison Kramer as he showcases incredible magic, mentalism, and mind-blowing skills. And with that, I'll throw it over to our moderator who joins us from Orbita, Chelsea Beal.
Hi, welcome, and thank you all for joining. I'm Chelsea Beal. I'm a nurse by background. I'm the Director of Clinical Informatics at Orbita. I'm here today joined by an incredible panel. We have really diverse backgrounds and perspectives for today's discussion, and I'm really looking forward to the conversation. Prior to introductions, I'd just like to cover off a few housekeeping items for those of you who are just joining us. There will be a recorded on-demand webinar available, so you can take a look for that. And also, we'd love to hear from you. As mentioned, submit questions at any time during the presentation and upvote them as you see fit. We'll take time at the end to do a Q&A, but we may also weave questions in during the discussion as well. With that, I'll have our panelists give an introduction and some background on themselves. I'll start. We have Chris Gervais, who's the Chief Technology and Chief Security Officer at Kairos. Chris?
Hi, thanks for having me. It's great to be here today. I'm super excited to talk about this. So as Chelsea mentioned, my name is Chris Gervais. I'm the CTO at Kairos. Have spent my career mostly in technology, been in and out of healthcare, done a couple of stints in different ways. One of the longest was, honestly being at Partners Healthcare, now known at Mass General Brigham here in the Boston area. So really got a chance to work inside of a very large, complex provider organization and live healthcare on the inside, and then, go back out and get a chance to work with, tech companies who are provider-led in Kairos to help, really accelerate what the health systems are doing. So it's super exciting to be here today.
Great, thanks, Chris. And we have Dr. Amy Compton Phillips, who's the Chief Clinical Officer at Providence St. Joseph Health. Amy?
Yeah, hi, great to see everybody. And I was going to say good morning, which reveals my West Coast base here, that for others, it's not so much morning. I'm Amy Compton Phillips, internist by background, and have spent my career really going from frontline clinical care into now really managing clinical care. And so now I'm at Providence. It's a 51 hospital system that employs about 25,000 physicians and caregivers, total 120,000 people in our system. So it's a big system, and I'm responsible for the health and care outcomes as well as the value that we deliver to our patients. And so absolutely been very engaged for a significant portion of my career in saying, how do we do that ever better, particularly deploying digital tools to make it happen in the world of today.
Great, thanks so much for joining, Amy. And last but not least, we have Firdaus Bathena, who's the Chief Digital Officer at CVS Health.
Thank you, Chelsea. You say last but not least, but it certainly feels like least being on this panel. I actually came from outside the healthcare world to Aetna about almost exactly 4 years ago. And then after the acquisition of Aetna by CVS Health, became the Chief Digital Officer of CVS Health, and spent most of my life before that in the venture-backed software startup space. Ended up working at a couple of really big tech companies as part of, acquisitions of the companies we founded. But, the only sort of claim to fame I have in the healthcare world prior to my joining Aetna is that I have been married to a practicing pediatrician for 26 years. So I can kind of roll with the best of them when it comes to, prescribing the Tylenol. But very happy to be here and excited about what the future of digital health is going to bring to the world, not just in healthcare, but, for overall well-being of the people we serve.
Great, thank you all so much. So first, as kind of we discussed the topic of the digital front door, I think we had a lot of great discussion around really the evolution of that and the definition of that. So I'd really like to hear from all of you as to what the front door means to you and your organization and your role, whether that be digital or brick and mortar or a combination of that. And also really curious to get your thoughts on if that's even the right term. So with that, Amy, I think let's hear from you first.
Sure. Well, it's a great question because, clearly we want to make sure we're all talking about the same thing. And in my mind, the digital front door or front door is, how does somebody who has a need find someone to help them? And what do we do to help match that? How do we reduce the friction and make that as simple as humanly possible? I work with a colleague, our chief digital officer came from Amazon. And he said when he came in, he helped build the Kindle. And the philosophy in building the Kindle was, how do you take out every bit of friction between an author and a reader? And so we've used that concept of, how do you get rid of every bit of friction between a person with a need, and I'm just going to call them a patient, although it might be a consumer, it might be a citizen, choose your term, but a patient and typically it's a physician or a caregiver, it might be a nurse practitioner. And so that means they have to know who to look for. They have to get a sense of, will that clinician help meet their need, or is it the wrong type of clinician? And is it someone who matches their practice style, their goals, values, belief, and is it convenient? And oh, by the way, can they get an appointment? So there's a lot of steps in there to go from getting that human being with a need to a person who can meet that need. And that's what the digital front door is really designed to do in my mind.
Great. Thank you. Firdaus, thoughts on that?
Sure. First, I certainly agree with what Amy said. Look, we have, 10,000 physical front doors around the country, right? One of the most powerful things about what we do is that we have both a digital and a physical presence that spans, almost the entire country. We are on a never-ending quest to be the most consumer-centric company in the world. And what that means is, meeting the consumer where they are. So I think this notion of like, let's all, try to create one front door and everybody tries to own that front door. I think it needs to be more conceptual in nature. Amy's exactly right. How do we meet a patient's or a consumer's need? Having them enter the system, if you will, whichever way they want. And in many ways, with digital technology, taking the door to them as opposed to having them come to a door, either in person or digitally, right? So we want to be in the home. We want to be in the community. We want to be able to create a seamless health experience across those. And I think there will be many front doors, whether they start in Google, whether they start, in a store, in a pharmacy, whether they go to a health hub, whether they, call a friend and ask a question. For the consumer, it's a quest to get something done. And we just need to be there for them in the place where they are, and not kind of shoehorn them into some kind of construct that we make up ourselves.
Yeah, that's a great point. Meeting the patients and the consumers where they are, rather than trying to force them into a particular path, and making sure that we're really empowering patients through that. Chris, curious your thoughts on this.
Yeah, I love hearing what was just said, because it's very much the mission that we've had in terms of thinking about the digital front door through the lens of patient access, and what access means. Has changed in the last 6 months so dramatically, both in terms of just the range of services that could be accessed, but also the nature of accessibility itself, right? We have now new patient populations who are trying to engage in new ways, and sometimes with digital tools that don't always match what they're trying to do. So you have this notion of, and that we get a chance to get this bird's eye view with the industry, with all the wonderful customers that Kairos has, of the scalability of what digital front door really needs to be. And a lot of that is based on, region and, the population and what's being served there by our health system customers, but also them trying to evolve, at a speed, certainly now, that I think is a little bit uncommon to what folks were used to before. And so it's not just that, a digital front door, it's all these different entry points. And I think what we're seeing too is, it's not how many do you need or which ones, it's knowing that you're going to need many, and they're not just experiments now. They're driving real value to patients and real volume. Now it's, how are they going to be sustained over time? And what is the capacity management strategy to make them come to life, to now in some ways invert the delivery so that you can meet patients where they're at versus dictating how they're going to engage with the system or the services that you have. And that's, it's ever more important to be able to have all that stuff well described and use consumer patterns that we just talked about finding and discovering that, and then making it easy, right? Making the things that were hard before easy. Some things don't need to be a phone call anymore. I want to do it in the middle of the night. But then also offering the scalable service. So if I do want to call someone and talk more, what are my options, making sure that that's available too.
If I could just pile on, Chelsea, to what Ferdas and Chris said, is the way we're talking about it now is how do we have it be so that there's no wrong door, that there's many doors, and how is it that any door could be the right door? It doesn't have to be the front door, it could be the back door, it could be the side door, it could be the phone. So, making sure that any door is the right door for that individual.
Amy, that's great. I'm going to steal that if you don't mind. I'm going to use that within our organization because sometimes we get into these like crazy discussions about like, who's going to own the front door? And, is my door going to be better than your door? And I feel like I'm in like a Game of Thrones episode then, it's like, what? Ultimately it's about like whatever mechanism the consumer, works best for the consumer is what's going to move the industry forward. So I'm going to steal that. There's no wrong door.
Consider it freely given.
Thank you.
Great to kick us off and really provide that context. I think it's so important as we're really seeing a dramatic shift, right, in the world that we're living in today. And along that line, I think as we've talked about, stories, I think now more than ever, really are important in connecting us. I'm curious from you all, do you have a personal story that you would share around what really motivates and inspires you in your role, and kind of bringing to life a little bit more of that experience? Thoughts? It looks like Amy, you are ready to go here.
Yeah, I'm feeling like an overachiever today because I can actually think of two, but they're really quick stories. So the one of them is that we were I'm out in Seattle, so we were at ground zero in the COVID crisis. And when we had the first patient and then we had a second patient, and then we had the cruise ship come in and there were more patients who were like, uh-oh, okay, it's here, it's real, we got to prepare for exponential growth. And so we called up Microsoft and said, if somebody Googles, do I have COVID? How are we going to be able to answer those symptoms, that question? And that's when we built the chatbot that then Microsoft gave to the CDC and to many others, right? So it was trying to figure out how could we meet the need in a way that if we weren't just going to have, because we didn't know at that point, like it was going to be exponential growth and we were going to be completely overwhelmed. So we had that, and we had this cool algorithm then that we built that you could go through if you have the symptoms, click here, and and oh, by the way, you could default to do you want an appointment with your doctor or do you want a virtual visit? And if you defaulted to a virtual visit, you then had to call to schedule the virtual visit. So we went from having this very cool electronically enabled system that you had to stop in the middle of this electronically enabled system and pick up the phone and wait on hold to be able to get an appointment. So it became very clear immediately that we needed to ramp up our capacity to deliver virtual services. So that's the COVID story on how we need to make sure our no wrong door experience is truly interconnected and seamless. My other story is a very much more personal story about my deaf brother who got cancer. So he has communication issues, right? That it's really hard for him. He has to call either using a TTY or needs to be able to communicate electronically. With multiple different physicians in a non-interconnected system, happens to be in St. Louis. And because every doctor is on different systems, because his healthcare delivery system has a disconnected inpatient versus outpatient record, and because he has communication needs that are beyond the ordinary, his care suffered dramatically. And he has gone into the hospital now twice for complications that were completely unnecessary. And it's because of the lack of coordination amongst providers. And so for him, because he had, door number 1, door number 2, and door number 3, and all of them were right for a specific issue, but none of them were right for him across the continuum, the plethora of doors made his care really horrible. And so as I'm thinking about the no wrong door concept, I'm thinking about the no wrong door from the patient's perspective across the entire continuum. And we need to have digital tools that solve for the patient's need, not the healthcare system's need, not the doctor's need only. It has to solve for that, but has to make sure that we're seamlessly weaving the entire journey, because there's going to be side hallways through all those doorways that patients go down. And somehow as we go through this process, we need to make sure we're weaving together a seamless digital experience to make it all work.
Yeah, there's a real opportunity here for us to make that more seamless, but then there's also the risk of contributing to that fragmentation. So absolutely critical to make that person-centered. Chris, curious on your thoughts on really that, again, that personal story that motivates you.
Yeah, you know, one thing that really motivates me was a few years ago, we traveled out to Glacier National Park on vacation, and we were like on a tour, and we stopped, and I was just chatting with the woman sitting next to me, and she was a nurse kind of out in Montana, and, you know, talked to me. I was like telling her what I did and what the company did and whatnot. And she was telling me about, oh, you know, that's really interesting. Kind of sounds like a big city thing. And I was like, okay, tell me more. And she said, you know, some of the patient community that I see and that I have to kind of figure out how to engage with are in these tiny, small towns, and they share a mobile phone. And so when we do a telehealth visit, we're calling them, and they're running down the street sometimes to give somebody else the phone so that we can check it up on them. And it kind of brought me back to some of the basics that I think are really important. You know, I, like others, we think a lot about all the technological progress, and, you know, there's 5G everywhere and video and everything, but there's also the time where we have to think about the scalability of accessibility around all these things. And her story really resonated with me as we, you know, design our solutions for all these different, you know, use cases and markets and people with different levels of digital literacy. It's just now more than ever at kind of a local level, can we drive, you know, thinking about how do we drive things like bandwidth, not just to play games with, but for education and for delivery of care into all these different parts of the country that we don't get to see. And, you know, I kind of think back to that a lot, and it sort of motivates me around not to get caught up in all the super high-end stuff, but what else do we need to do to make sure that we can make this, you know, democratized and drive access really as far, you know, across every socioeconomic level that we can.
Mm-hmm. I absolutely think that gets to that social determinants of health. And I think later on in our discussion, would love to get your thoughts around opportunities for improvement, where we've seen potential gaps that maybe have been highlighted as a result of the current pandemic. Verdas, thoughts on your personal story?
All right, this might sound a little cheesy, but, you know, the thing that motivates me the most is what I see my wife doing every day. You know, there's a lot of talk these days about physicians and nurses on the front line. You were one of them, you know, Chelsea, you know, being superheroes, and not all heroes wear capes and all of that stuff you see, right? Well, it's just now we're talking about that, but they've been doing it for a long time, right? Here's the story that gets replayed again and again in my house that makes me think about the people who don't have the kind of access that I'm lucky to have. You know, I say to my friends, I take my kid's pediatrician everywhere with me, wherever I go. I decided to, you know, get married. That happened the other way around, but whatever. Every once in a while, you know, family and friends will call or text my wife and say, you know, my child has a rash, or they came in from playing the outside in the Northeast in the summer, you worry about Lyme disease. And, you know, every parent I know has gone through this. It's 10 p.m. on a Saturday night, and little Johnny is pulling on his ear and screaming in pain. And, you know, you don't know whether it's an ear infection or whether his sister jammed a pencil in his ear and, you know, perforated his eardrum. What is someone supposed to do, right? You know, when you go outside of the bounds of sort of the system as it's set up today, what are people supposed to do? When these people reach out to my wife and they bring the child over and I make the coffee and keep the parents engaged while she checks out the kid, I think to myself, holy crap, wouldn't it be nice if every parent in the world had an option like this for their family? Wouldn't it be nice that nobody would have to think about, what am I supposed to do here? Do I drag my screaming kid into the car and drive to the ER? When's the last time a friend or family member told you, I loved my trip to the ER last night? And, you know, we all know that avoidable ER visits are one of the single biggest drivers of, you know, medical cost in this country. So why can't we create the tools? We have the technology. We have the connected otoscope that you can connect to your child's ear. We have the AI that can then determine whether that's a, you know, 72% likelihood that it's a regular infection. You just need an antibiotic. Click here to start a telehealth consult with a nurse practitioner who could be across the country or down the street from you. And 45 minutes later, you know, the drugs are delivered to your door, you know, someday in the future by a drone. Forget the drone part, but all of the rest of it exists today. We're doing tests with drones too, but all of that exists today. I think the key is, how do we stitch together these technologies in crisp, meaningful, impactful experiences that make a difference to people? That's what motivates me every day, because I see it being played out in my house. And I wonder, you know, what will it take for us to bring that level of convenience and comfort and value and safety to everybody?
Yeah.
I, as a parent, would pay, you name your price, I would be willing to pay to not have to drag my kid to an ER on a Saturday night and find out that it was something totally benign.
Mhm.
But here we are.
I share a similar perspective in that I actually grew up in a rural town in Wisconsin, and my father is a primary care physician. So the front door for people in my town was oftentimes the grocery store. I can't tell you how many times we got stuck for hours in the grocery store, just having those side conversations with people who had questions, who said, oh, do you just mind going over in this aisle and taking a look at my arm? I have that rash that I wanted you to take a look at here, and here you are. So absolutely. I think that that also gets to, and what I'd really like to hear from you all around is how to measure the impact of some of these digital tools and these experiences. As we've really highlighted, it's really about that that patient and the patient outcomes and experience. So just curious what you all are seeing and how you all are trying to quantify and measure the impact of some of these newer interventions.
Yeah, you know, I can take a shot at that. And for us, you know, one of the things I worry about is what you were saying is, oh yeah, ear infection, need antibiotics. Well, it turns out that we're really worried not only about, are people getting the appropriate care, but are people getting overuse of care? Because as you know, right now, antibiotics are not always the first line treatment for an ear infection. And so how do we make sure we're measuring not only the inputs, the process kinds of measures to say, you know, are we doing the right things as measured by standard measures that we would, things like HEDIS measures, right? That we look at across the board in healthcare. Do people getting their immunizations? Are they getting the right treatment for the right condition and too much treatment for the wrong condition? But we're also trying to now ask patients about the experience and the patient reported outcome measures. So not you know, patient experience is how were we? Patient outcomes are how were you? Did you get better because you received medical care? And so making sure we're using tools that help measure that, which specifically means asking the patients about their health condition after treatment, is a critical way to do that. We do know that overtreatment can drive patient benefit. So that's why we have to have balancing measures to say, are we using things according to the evidence? But I think that's going to be critical. And looking at that patient experience, back to your comment, Ferdas, about being the most consumer focused company, although, you know, I'll arm wrestle you for that one. So that, you know, how do we make sure we're not only doing the right thing, but educating patients when, or people in need, that when it's potentially the wrong thing, because the simple thing is to overtreat sometimes. And when you don't have that ongoing relationship, and it's one of the reasons, by the way, that we're actually trying really hard not just to offer urgent care on demand, but continuing care on demand with a provider that you know and care about, like your doc in the grocery store, right? Your dad probably wouldn't do that for a stranger, but he's going to do that for his patients that he has known for a long time. How do we make sure that we enable that front door back and forth to the person who has a relationship with the patient in addition to urgent care needs?
That's great. Chris, Fardas, thoughts?
One thing I will say is, Amy, don't take anything I say about medical care seriously on this call, please. Just examples. I am not a physician. Look, I came from the tech world, so we brought with us, and we already had, I guess, a bunch of all of the things you look at when it comes to funnel metrics and conversion rates and all of that. And that's great from a digital perspective. But Amy's absolutely right that the thing that matters most is, are you achieving the outcomes that are in the best interests of the patient? And one thing I've learned both at home and, in the workplace is very often the patient, is not aware of what are the best possible outcomes for them. And they're asking for things that may not make sense. And that makes this a very difficult problem to solve. I get asked all the time, what about quality metrics on physicians? Well, you know what? If a physician tells you something that you are not happy to hear and you give them like a 1-star rating because of that, is that the right thing? I know a lot of physicians who get pretty upset about that, right? Like, we're trying to do what's right. It's not just about, bedside manner and whether they, had a timely appointment, but it's about doing what's right for them. Very often, may not be in sync with, what they perceive as what's right for them. And that's not a problem, we can solve overnight, but, and so this measuring of outcomes becomes hard. It has to be done from different perspectives. And we have a lot of data science. We have a fantastic data science team, and, God bless everyone who wants to be consumer centric. I encourage everyone to sort of aspire to be consumer centric. And what we do is we look at outcomes using the data, and we use that then to drive a feedback loop through the things we do. Like, one of the things we do is next best actions. What is it we recommend? Now, do we always get it right? Absolutely not. Do we try to do that in a way that is disjointed from, the providers who we believe have a very precious and powerful relationship with the consumer? Absolutely not. Sometimes people ask me like, well, you have all these minute clinics and health hubs and stuff, like, how does that complement the, the doctors that are out there providing similar? So, and I'm like, we are the biggest referrers to PCPs out there. Mm-hmm. We want everyone to have a PCP relationship. We want them. We encourage that. We want to complement what is provided out there in the PCP networks. And I think if we all think about it as from a consumer-centric standpoint and try to move the industry forward, that's the rising tide that's going to lift all boats here.
Absolutely. Chris, how are you all kind of thinking about measurement in today's world and thinking about access?
Yeah, so we're in this kind of interesting position where as Ferda said, we're helping our customers do things like establish funnel metrics and stuff up top. But the other part is, while we're not directly connected to some of the outcomes, it's helping our customers just understand where they do have these different capabilities to engage with patients in different modalities, and sort of what is the best way that we can help them provide the best connection to the right care, which hopefully will lead to the right outcome, and route them properly through different types of services that are available based on different ways that patients are describing their own kind of acuity or intent, which can sometimes be kind of generic. And in which case, you want to be able to either prompt and get a little bit more to drive to a very high, a high resolution match in that case of the right patient, to the right care at the right time with the right preparation. And some of that is just making sure those feedback loops are established. And, we're just part of that, but helping them to establish those loops and understand how to use some of that data in different ways of looking at the incoming trends, what could be changed, maybe today, so that when those same queries are coming in tomorrow, they might be answered in a way that is going to, drive the patient to a more, relevant care option for them. Or, again, direct them to say, look, for the way you're describing your need, you really do need to talk to someone. So when we're thinking about outcomes, we're trying to think about with our customers, how are we helping them use all the wonderful assets they have and leverage them, in the best possible way. And then trying to kind of mine that over time and say, okay, did that work? And how do we help our, how our customers can tell us they've improved their agility is in some ways one of the best outcomes that of success metrics that we can, I think bring to the table.
And I think I'm really interested, that dovetails into the pace of growth that we've seen recently and the impact that COVID has had on the healthcare system. So curious and really would love to hear your thoughts on what we've seen as far as this acceleration and how healthcare may have, shifted really, I think from we're always going to have that pre-healthcare system, pre-COVID healthcare system to more of that post-COVID world. Curious to hear your thoughts on that acceleration, what some of those levers may have been here.
So maybe I'll take that first, because if any of my team is listening to this, they're going to be like, Firdaus, now you're going to talk about what we've done. Yeah, I think the story is probably repeated across many companies in this industry and many organizations for that matter. Look, one of the ways we look at this is there was a lot of stuff that was in flight already. We knew it was coming. We knew there was going to be more virtual care. We knew there was going to be more delivery for pharmacy, things like that. We just didn't expect that 2 or 3 years of growth was going to get compressed into a 3 or 4 month time frame. So that's one way to think about this, right? Stuff that we were already doing and that we thought was on our roadmap and that we would sort of scale into over, a longer period of time suddenly became, whoop, it, got scrunched into a short time frame. And then the other is we had to invent completely different experiences. We didn't have a massive testing program that was digitally screened and scheduled and digitally resulted until, COVID came along. We started in, I want to say April or early May with 5 sites in 5 different states. Today we have over 1,800 test sites between point of care testing and swab and send testing. And you heard about it in the news. I'm not going to elaborate on that, but that would not be possible without very rapidly leveraging digital tools, working with partners, working across the organization. I take my hat off to the people in the field who've been doing the work to make those happen. This is most certainly not just a digital effort. Partnering with the labs, partnering with the test companies, the device makers. It's been a Herculean task. And I think one thing that's very heartwarming, I guess, is that it maybe took a global pandemic for this, and that's unfortunate, and nobody wishes that to have happened. But nothing brings the industry together like a crisis, to have people working together rapidly, putting aside all the BS and all the bureaucracy, and really focusing on what is the right thing to do for the consumer. This is an anxious population, doesn't know what's happening, needs testing, needs resulting, and needs to know what to do, whether the result is positive or negative. And I'm really proud of not just our company, but everyone across the industry who's played a role in doing that. So that compression, as well as having to develop brand new experiences, I think has upped the game for all of us. And I think all of us have risen to the challenge. And I think it will go down a little bit as we firmly put COVID in the rearview mirror in the next 12 to 18 months. But it will not go down to pre-COVID levels. There is no pre-COVID anymore. It is only a post-COVID world, and it may slow down and maybe plateau for a while again, but that'll be a step function above where it used to be when it comes to digital demand and engagement.
Yeah, it's such a great point, because one of the things I think about too is through this hockey stick period that we just all lived through, and I'm experiencing it at home right now because my home internet connection is not actually keeping up that well, is what would have happened if this was 5, 7, 10 years ago, right? Because I kind of think about that, and we are at a place now where in healthcare, the cloud, and I hate to say the cloud in that way, has been normalized, right? And so this we don't have to wait for the truck from Dell to come put servers in the data center anymore to get new capabilities provisioned. right? The elasticity of the cloud world and SaaS solutions meant that things could get turned on kind of really, really quickly, and that with regulatory help and compliance help, some barriers were removed to being able to respond and get the virtual care and telemedicine approach, paid for in some ways, not equally, but, at least remove some barriers there. And so I also think about, is the momentum of taking things that were experiments that now got thrown into production, and now we've got to, make them part of our overall, digital portfolio, and that acceleration of the transformation, is that going to stick? Is it going to ebb back and things will recede? Because I feel like so much of this is here to stay. And now it's not, can these solutions work? I feel like it's now the next step is how they're woven together, because you're going to have so many people who've experienced these solutions and just want to stay using them, right? And so now it's how are they going to be woven together into these models where if you just want to do something transactional, it's easy. If you want to do something as a more active patient, find a specialist and book an appointment and spend some time there. It's easy. And if you're truly, managing maybe a chronic disease state, that those different care team members and other experiences can come together in a way that they hadn't before. And as a technologist at heart, it is heartening to me to see that we've been able to move fast, because some of the models that were just taken for norm in other parts of the world in consumer or e-commerce have now been adopted, and we can get that elasticity of scale up that I think was so important to making some of these responses work during this time.
Yeah, I think you guys have hit like the really critical big points. Our experience within Providence was very similar to the rest of the country. In 2019, we did 70,000 virtual visits. In April of 2020, we were doing 70,000 virtual visits a week. So we went from the volume in 1 year to the volume in a week. And we had about 90% of our just physician office visits, and whether that's primary care or specialty care or urgent care, being done virtually. Now, since that time, that's fallen off, but it hasn't fallen off to pre-pandemic levels. It's fallen off by half. It's about 45,000 now, 50,000 visits, because some patients want to come in and get seen, and some patients want to get seen virtually. And so back to our initial conversation about no wrong door, we now have optionality. But what that tells me, that capacity, in exactly like the glimmer of a silver lining with a really horrid pandemic, is that the technology in the past was not the barrier. It honestly was both patient acceptance, will this work for me, as well as the fact that the payment models did not support telehealth. That telehealth was either not reimbursed, not a benefit, or was reimbursed at dramatically less. And so docs were going, I can't pay my student loans off if I do telehealth, even though patients want it. So I'm going to have patients come in. Now with the parity laws, and also in practices where there's a lot of capitation, the payment barrier has fallen away. And with the people wanting to medically distance in addition to social distance, the patient adoption barrier has fallen away. And so it has formed a lasting transition. I think the pandemic as a portal into a new world is a real model. And that now the question is, how do we iterate on it to make the experience ever more seamless, both for the patient and the provider, but also how do we make sure we have the advocacy to ensure that providing care in a new way, digitally enabled virtual care, is something that actually is sustainable in the long run for all.
Yeah, really important point as far as some of those barriers and what's really been able to be lifted to force this shift in adoption. Before we turn it over to an open Q&A, I'm just curious to get your thoughts on really the gaps that we've seen and what opportunities exist as far as reaching patients. Chris, to your point around the social determinants of health and some of the digital literacy that we're seeing, can you just comment on thoughts on what we need to do to continue to move the needle and to continue to sustain these improvements?
Oh, there's so many things. It's hard to kind of boil it down. I think, some of the areas that, we've been focused on as we think about, again, patient access are, and in the social determinants of health that we think we can impact are, how can we continue to offer digital tools that are going to enable populations to get access, based on, can they find a provider who speaks their language natively easily, who understands maybe particular, I don't know, health or mental health issues that of their population that's close to them, and how can we just help to address some of those things, both from accessing care, but also providing digital tools that are built with accessibility in mind. And I think that's another area that as folks who before maybe were coming for care in person are now going to opt not to. We have to think about not just the last mile of that connectivity, but also how to incorporate these other components that are very relevant to help me find and decide, as well as grow and understand when I'm getting care. And that's another area that we continue to invest in, but also if we can just help folks describe really what they do better and the services that are offered in a more standard way, whether you're finding it through Google on your own, you're asking Siri or whatever, that's hopefully ways that are opening up and dropping some of the barriers too.
Yeah, I think that's spot on. And back to that conversation about removing friction in the healthcare system, one of the ways that we think about digital tools are that they allow us to move knowledge, not people. And so whether or not it is, somebody in a rural area that needs help, well, they can not only Google on the condition, but they can get, chatbot assisted help with their personal questions, because there's enough AI now and learning in the system to actually start answering some questions. And then if they need to go on to something else, they can now actually get, either chat with a clinician, which is simple and easy and can be either synchronous or asynchronous, or they can get connected live into either an audio or a video call, right? And so those kinds of things are incredibly helpful. And if you live in a healthcare desert out in one of the rural states, we have areas that have vast wide open spaces. Think about Alaska, where we provide half the medical care. It is incredibly challenging to get care where people need it. And so using the digital tools, we can do that. And by the way, that includes even super specialty quaternary care for the liver mass that somebody's trying to work up from a gazillion miles away, or who comes in dragging their left arm and unable to speak and turns out is having a stroke. But now with digital tools and telehealth solutions, we can deliver cutting edge quaternary care into rural areas that otherwise would have zero access. So I think that the tools we have today are absolutely remarkable in transforming the outcomes for tomorrow.
So I'll just add to those excellent points with with three things that are among the things we look at very closely. One is we believe that health is not something gets done to you as a consumer. It's something that you have to participate in. And so we're trying very hard to make sure that when it comes to addressing sort of all of the social determinants of health, when it comes to holistic well-being, we are doing our best to make sure that we engage with customers and with consumers and increase their engagement, their understanding of why they're doing what they're doing. I mean, people are just way more motivated to do something when they understand the why. Again, it goes back to the golden circle. And the way we do that, because there just aren't enough providers to sort of talk to people on a day. I'm not in a health desert. I live outside Boston, Massachusetts, right? Super dense when it comes, and yet, finding a provider for a member of my family is extremely difficult depending on what you're looking for. And I'm married to a physician in the area. I mean, that's how hard it can be sometimes. And so, part of that is demand and supply, I guess. But part of it is also, how do we engage people? How do we have them truly internalize that health is something that they participate and engage in? It's not this episodic thing that gets done to them on a periodic basis by somebody else who has a lot of degrees. And one of the mechanisms that we have found that has worked extremely well for us is these little bite-sized, what we call healthy actions or next best actions, right? I prefer the term healthy actions. You ask people to, my PCP is always giving me really great advice when I go see her in Boston. How much of that do I actually do? Don't tell her, and I hope she's not on the call right now, but it's very hard, no matter how motivated you are, to sign up for something, on an annual basis, leave alone sort of a 12-week program to achieve something. But if I can give you short, sweet, healthy actions that are easy to do, fun in some ways, and build that addictive loop that is so well used by the social media companies. Just ask my 3 kids who are on Instagram all day, right? It's not Facebook anymore. Why can't we use some of those same principles from the tech world or from the social media world to achieve something very positive, which is to get people addicted to their own health? That's an aspiration of ours, is to say, why can't it be made just as interesting, just as fun, just as, that little mini reward loop that keeps you coming back? You post something, somebody likes it, somebody comments on it, positive comment, makes me want to post again, so I get that little head rush again. That's that loop of addiction that they talk about, right? Wouldn't it be awesome if we could do the same thing with the end result being a better life for people? That's a big part of kind of what we look at very closely with some of our experts in behavioral economics.
That's fascinating. I think at this point we are at the Q&A portion of today's panel. So I'm just going to take a look. There's been a lot of great questions that have been submitted. We've definitely covered some of these off, but I think one of the questions that would be interesting for the group to comment on, and Amy, I know I'm thinking of you in particular in this question and some of the discussion that was had prior to today's webinar, but it's thinking about, the question is posed around, we're talking about clinical encounters, but what about the rest of the experience for the patient and the rest of that relationship, including the revenue cycle aspects of that? So how do we go beyond just focusing on those clinical activities and bringing the patient through to that full end-to-end experience?
Yeah, it's such a great question. We actually think about the experience in 3 big buckets. And so one is, how do you get into the front door? So how do you get access to care through no wrong door? What is the seamless journey? Like I was talking about with my brother, how do you make sure you're navigating the many twists and turns that any one journey takes? And the last one is, how do you close the door behind you? So what is that patient financial experience? And so we actually have large bodies of work in all 3 to see if we can make this, if we can basically simplify health. It's just too blooming complicated right now. And in that closing the door behind you part of care, what we're trying to do is also use a lot of digital tools, including things like we now have a blockchain-enabled company called Lumetic that actually works on matching up pre-authorization with the actual care delivery experience so that the bill gets seamlessly put through rather than having lots of people handing it off. Because I don't know if you guys have ever had anything complicated with anybody in your life, but you get like 750, this is not a bill statements from somebody, all of whom you have no idea what they mean. And then you get a few bills and then you get somebody from a collection agency that says you haven't paid. And I'm like, well, what am I supposed to pay, right? So we're trying to solve that and have that broken down into numerous steps and started applying technology in where we can layer in technology because, I would love to have done this with the pandemic, but we don't just get to throw out the entire system and get a do-over. So we have to do the really hard work to say, let's break it down into the component parts and improve the process bit by bit.
Any other thoughts you 2 would add, Chris?
I love that perspective too, because, you kind of have to be like Neo in the Matrix, right? And dive in and swim in it and try to figure out the angle that you can, that you can push forward, because you can't just blow the entire thing up and expect that something else is going to kind of replace it at light speed. We have to work with what we have and start continually reshaping it and improve the morphology of it as we go forward. To address and just looking at some of the questions that are or have been piling up, around some common themes here, to address that. And I am hopeful that this kind of velocity that maybe we've hit on right now is going to continue. And I think that's one of the things that I really hope we see kind of going forward. But I really, Amy, love that perspective you have there, because I think it's right on.
I just have a comment here. That is, there is certainly a technology challenge here, right? We're dealing with so many disparate systems, so many, archaic systems, clinics and providers who, with good reason, have not sort of kept pace with the world of technology in general. But a bigger problem is the incentive problem. Are we all incentivized to kind of do the right thing, or are our incentives all over the map, which makes us behave in ways that prevent this kind of seamless experience from happening? When I first came to this industry in a real sense 4 years ago, and one of the things I learned was, people want to know about pricing. I was like, yeah, that makes sense. How hard can it be? There's a price list somewhere, right? Right? No, not right. And now we have, a data science team that works with machine learning models to model, pricing bundles for all of the different stuff that we support. And it blows my mind that, like, with the right kind of incentives to simplify our structures and get better aligned, the technology would be able to solve the problems that much faster. So we need to attack this from both sides, which doesn't mean there isn't a tech problem, all right? There is absolutely a tech problem. I mean, my team would kill me if I sat here on this call and said, well, there's nothing, technology is all solved. That is not true. And yet, technology only moves forward with people, and with people with sort of aligned incentives. And I've seen this in other industries in the past, and it's absolutely true in healthcare.
And Amy, I know you've commented on that. I don't know if you have anything else that you would add as it relates to those incentives.
No, I think you're spot on. And it is what we've been talking about now. And I have to say, I spent 22 years at Kaiser Permanente before I joined Providence, and Providence is in the more fee-for-service kind of market, the one that 97% of Americans are in. And Kaiser Permanente is in a capitated market. And it's a heck of a lot easier to be in this prepaid, capitated accountable care type model, both for the physicians and for the patients. But right now we are dancing our way between those two things. And in that dance, it is really challenging. If we could flip a switch and put everybody into, Medicare Advantage plans and bundle-based payments and, some kind of accountable value-based infrastructure, it would simplify life. But for a lot of reasons, the same reasons that we couldn't get people to adopt telehealth before, pre-pandemic, right, are the same reasons that we can't just completely change the way people pay for and get paid for healthcare today. And so we've got to figure out, what is the COVID crisis for payment reform so that we can do the same kind of rapid transformation there as we have in the clinical side.
Yeah, that's great insight. Just going through the questions, again, we have a lot of great ones. One of the questions that has come up a few times here is related to social determinants of health. And obviously we've touched on this as far as opportunities to improve access and think about ways to really bridge that gap for those patients. I think as I think about this and some of the work that we've done at Orbita, it's really about meeting the patient where they are. So one of the examples that comes to mind for me is that we have all of this fancy technology. We have chatbots and voice assistants, but one of our customers that we were working with, they were looking at something to engage with chronic kidney disease patients. So a national kidney care organization looking to engage with a population that maybe not as readily accepting or adopting of some of this technology. So actually what we saw was taking an approach to meet that population and be very specific around our design in that program to actually use IVR that's powered by conversational IVR to conversational AI to engage with those patients, to provide them an opportunity to have an experience to get screened before an appointment, to ask questions, to escalate up to a live agent, but meeting them where they are, because we have that technology, but that doesn't mean that it's always the right approach for that particular population. Curious on your experiences and anything that you would add here.
I think you're absolutely right. We've actually done pretty much exactly the same thing. We have, especially when it comes to, so I'll give you a very simple example. Somebody takes a COVID test today at a CVS test site. What's the first thing they want to get? They want their results, right? That people have different levels of anxiety. Some might be because they're about to go in for some important surgery and they need a test result before they can do that. Others are traveling elsewhere. People are going back to work. I know my wife needs to get tested every couple of weeks or 3 or 4 weeks, whatever it is. So, if we have one mechanism by which you get your test result, that'll work for a certain part of the population. And, our texting-based resulting is actually working extremely well. But there are people who would rather, call in. And so we have built the same kind of capability through the IVR system. So I totally support that. One thing that, for better or for worse, it's just a fact that we bring to the table that, not a lot of organizations have, is our physical presence in communities around the country, right? So when we picked, for example, the COVID testing sites, and I think I mentioned we have over 1,800 of them right now, I think we did the best job we could possibly do to pick sites that specifically served underserved communities as well. And in those places, we actually gave people a walk-in option too. And I think it's that, the key word I think here is empathy, right? Like, do we have empathy for the users we serve? You mentioned kidney disease. I'm very proud of our CKD program, chronic kidney disease program, where we have user-centered design thinking sessions in which nephrologists and nurses and patients are sitting in the same room with product managers and designers and architects, and that's when a lot of the magic happens, right? But we must never forget. I think it's very good you brought up the fact that there are a lot of people who can't access those channels yet, and while a bunch of us might wonder how that's possible in a world where, our kids all have, mobile devices and have, the kind of access that we are used to, that's very much a reality out there. And we see it. We see it with the COVID testing that, the data shows affects underserved communities more than others. And, how do we make sure we get those people the best help possible?
Yeah, Firdaus, just to pile on that for one sentence, because I know we're coming to the end, that in our world, health equity is an absolutely enormous issue, and technology is a technical solution to a complex adaptive problem. And so it is again, part of an answer, but what we've been doing is really partnering very deeply with underserved communities to say, tell us your needs. And then we can figure out how we can partner with you, because one of the big crises in communities of color is lack of trust in traditional healthcare organizations and traditional institutions. And so we have to start with meeting their needs the way they see them, where they are, not coming in with our predetermined solutions and say, here, look what we're going to do for you. And so we're starting there. And in fact, it included things like, I love the fact that you're partnering broad communities with testing. We had vans, and we said, you tell us where you need testing and we'll bring the van and we'll set it up where you need it. And by the way, while we're there, if you're short on immunizations or short on other needs, and here, have some PPE, because I know there's a lack of it available in the community. So really trying to make sure that it's done in partnership in a way that engenders trust is essential to helping get at solving a highly entrenched issue.
All right. So with this, we're about a minute to our closing time here. So just want to open it up for any last kind of parting comments. I really think that last question really embodied a lot of what we have been talking about. But just quick last parting thoughts here. Firdaus, I'll start with you. Oh, we've got you on mute.
My apologies. I'm a techie, I'm an engineer by training and a product guy at heart, but I will say this is not just a technology problem. This is technology and people and process working together to create solutions. And most importantly, we need to engage the patient. We can't view it as we're doing this for them or to them. It has to be done, as a partnership.
Yeah. Chris, thoughts?
Yeah, I think we're learning what scale means in many different ways, right? Again, not just technical scale, but scale of these solutions to drive availability and accessibility, and having the patient and also having the provider's voice being part of that design and the new types of solution design. I think many folks in health systems are going through is going to be continued to figuring out which of these things are going to be successful and really drive long-term change and value.
Amy.
That I think out of this really horrific 2020 year that we've lived through, we actually will come out at the other side of it in a post-COVID world with an infinitely more patient-centric, more outcome-delivered, focused system at the end of it. And so I really think we're going to take what has been a really awful situation and turn it into what we hope for, and that's health for a better world.
Thank you so much. So everyone, if today's discussion sparked your interest, we have a lot of great resources on the Orbita website. We have white papers, webinars on the digital front door, other virtual care solutions for both providers and pharma. So please take a look at that. We'd be happy to have a follow-up conversation. With that, I just want to sincere thank you to our panelists. This was an absolutely great discussion. Really appreciate your perspectives you brought and some of those personal stories you shared. And I'll turn it over now to our health team.
Thank you, Chelsea, and to all of our panelists. If you'd like to continue the conversation, please join us on Twitter. And now, prepare to have your mind blown as we welcome Harrison Kramer to the virtual stage.
All right, I think I'm here. Am I here? Can everybody hear me and see me? All right, so Chelsea, go ahead and unmute yourself, and you, sir, as well. Oh, we got a bunch of people here. This is perfect. So guys, my name's Harrison Kramer. If you can see and hear me right now, just wave your hands on the screen like this. That way I know, perfect. I see a bunch of people waving their hands. I want to try something right off the bat. Chelsea, can you see the two cards on my shelf there, the 5 of clubs and the 7 of hearts?
Yes, I can.
Now, if I was to take my camera here and take a picture of those two cards, which one would be bigger in the picture?
The hearts.
The 7 of hearts, right? It seems larger, but because you're not here, you don't know. Maybe that camera's not real. It's this sort of weird give and take with virtual magic. Likewise, this 5 of clubs, while it seems to be slightly smaller, is actually much larger than the 7 of hearts. So you see, this is virtual magic, a place where you're not here and you don't trust me because you all see everything out of a tiny little camera. So what I want to do is I want to try something that sort of happens on the other side of the screen. Could we get Chelsea? I want you to just close your eyes for 1 second. And I want you to imagine that you see me at the end of a hallway. And what I do is I grab out a little manila envelope and I write a number on the envelope between 1 and 100. And you see me slowly write it. And now open your eyes. Now I've just done that. I've written a number right here, and I'm going to try and send it to you, and you're going to try and pull it out of my mind. You ready? So here we go. 3, 2, 1.
7.
No way. You could have said anything. Look at the number that I wrote. What is it?
9.
So between 1 and 100, that's pretty good, right? You were very close. Give her a little round of applause there, Liz and there. No, Liz and Lancey, please stop. Please stop. This is not close enough. It's a magic show. I have to get it right. So what I did was inside here, I wrote a prediction about something that I thought might happen. You see, I wrote that Chelsea will be off by 2. Which is exactly what Chelsea, so it's super weird. Well, we can actually sort of get into your mind there on the other side of the screen. But I want to try this with Lisa for a minute. Lisa, instead of having you pull a number out of my mind, I want to try and place a number in your mind. On my phone, I have a list of 100 different objects. And right over here in a bag, I have one of those objects. Now, I don't want you to think that I'm influencing you 7, 8, 9 to choose any number specifically. But you can think of any number you want right now between 1 and 100. You have a number in your mind?
Yes.
And it's not like 44, is it?
No.
No, because I wouldn't want them to think that you're basic, right? I would want you to go for something random, something that nobody could know. So for the first time, please tell us out loud, Lisa, what is the number that you're thinking of?
12.
12, and you could have said anything. Look at this. In my list here, can you see right there, it says random things?
Yes.
Okay, so I'm going to click on random things. And what does it say at 12? Can you see that? What does it say at 12?
Mickey Mouse.
Oh, I'm sorry. Actually, that's the celebrities list. Let me go to random things. That's my mistake. What does it say at 12?
Wooden pole.
So if there's a wooden pole inside this bag, that would be amazing. And I would
That would
only
be
know that if I knew that you would choose the number 12. So I'll just wiggle your fingers at the screen like this, Lisa. No, don't do that. You look silly. Stop it.
I know.
Okay, here we go. Ready? 3, 2, 1. Just like that. We get a little bit of a wooden pole, and then a little bit more, and a little bit more, and a little bit more, until we have a giant 8-foot wooden pole. That's exactly the number that I wanted you to choose, Lisa. Number 12. Give her a little round of applause there, guys. She deserves it. Thank you, Lisa. But now, Nancy.
Yes.
I see you over there, and I know that you're the person whose mind I really want to get into right now. You're about to make a couple decisions, but before you make those decisions, I want you to get a number in your mind between 1 and 4. Do you have a number in your mind between 1 and 4?
I do.
The number's not 3, is it?
Maybe it is.
It was, wasn't it?
Yes.
Yeah, everybody chooses 3, but I want you to choose something that's random, not 3, but you only have 3 other choices. So just get one in your mind right now, but it doesn't really matter what it is, because over here I have 4 bags. This is bag number 1, Nancy. This is the one that I want you to choose. You can choose any one of the bags. This is bag number 2. It's up to you if you choose this one, but it doesn't matter to me. Of course, bag number 3, nobody ever chooses bag number 3. It doesn't ever get chosen. You probably shouldn't choose it unless you want to. And then there's bag number 4, mysterious in every way, but of course, nothing in the bag. You wouldn't have to worry about number 4 at all. And you can choose any bag that you want. Whichever bag you choose, I'll take my hand and I'll slam it down on the bag as hard as I can, Nancy. But again, don't choose number 3 unless you've already gone for number 1 after 2. 4 is good first if you've already chosen 3 before 1 after 2. So whichever one you want, don't let me influence you. Name a bag.
1.
Bag number 1, amazing. We have bag number 2, 3, and 4. It's up to you. Which one would you like, Nancy?
4.
Okay, maybe we'll use Chelsea for this. Actually, I'm just kidding. Number 4 over here. Do you want me to slam my hand down on 4, or do you want to change? Because if you change, something different could happen. It's really up to you. I mean, I couldn't know. Which one do you want?
I got to stick with 4.
That's bag number 4. We have bag number 3 and bag number 2. Now, Chelsea, which one do you think Nancy's going to choose?
I think 2.
Now, Chelsea was just part of the webinar. She was talking. She was very important. So maybe Nancy now will choose number 2 because you said 2. That might have influenced what you think. Which one do you want me to choose?
I think we're going to have to do number 2.
Now, see, she was influenced. In a second, I'm going to slam my hand down on number 2. Unless, Lisa, you say change. But whichever bag you choose in the end, Lisa, I will slam my hand down on that bag. And it could be bag number 1 or bag number 2. It doesn't matter to me. Whichever one you want.
Let's go with, 1 or 2. Let's go with whatever they said.
They said 2. Are you sure? Do you want to change? I'm going to slam my hand on number 2 unless you say change, in which you can change. It doesn't matter.
Let's do 1.
Oh, you're going to switch to 1?
Yeah.
You don't want me to slam my hand on this bag. I will.
No, I know.
That's number 1, which leaves us with number 2. Not by any chance, Nancy, the second number that you had in your mind, was it?
Not by any chance. Maybe.
Oh, well, it's a good thing we left 2 at the end. Inside number 2, I always leave the nail in the block of wood to prove to you guys that you were being influenced the whole way through. Thank you guys for saving my career as a sleight of hand guy. So now, thank you so much. So now I want to see if I can try something with someone's imagination. Now, if you have a good imagination, just raise your hand like this. That way I know. Absolutely. Oh, there we go. Oh, so 2 people here. Oh, we got all 3. That's amazing. I think I want to try this with Lisa, just because of sort of that. You notice the weird sort of the way the ceiling connects to the wall. There's this sort of zigzag thing going on. I'm drawn to that. I think this will work. Close your eyes. And I want you to imagine that you see a lady at the end of a hallway dressed in red with a crown on her head. And she takes out a deck of cards and she shuffles it. And then she takes 1 card out of that pack and she holds it out in front of you. and you can see the value, the suit and the value. Don't open your eyes, Lisa, but can you see the card in your mind, Lisa, the card that she's holding? Don't say it out loud, but you can see it. Yes, you know exactly which card it is?
Yes.
And you're visualizing this. You can see that lady dressed in red with the crown on her head holding that card. Lisa, open your eyes. It wasn't the 10 of diamonds, was it?
No.
That would have been crazy. I can't do that. I wish I could.
That would
have been nuts, right? But what we'll do is with this. I'm going to spread them out on the table, and you're going to say stop anytime you want as I move my fingers along the cards. When you say stop, say on that card there, whatever card that you stop me on is going to be the card that she's holding in her hand. But you have the choice to tell me when to stop anytime.
Okay.
I'll start here. I'll go really slow. Oh, I hope they can all see. Yeah, there we go.
Stop.
Now you stopped me fairly early. Textbook sociopath, but that's okay. Do you want to change? Do you want to maybe go this way? Do you want to go back? We're on Zoom. Like there might be lag. I might be cheating, which I am. So do you want to change? Or are you happy with what you chose?
I'm going to stick with textbook sociopath.
You might be. I mean, I don't know. It's just a line, but here we go. I'm going to pick these up and I'm going to place it right here. Now, for the first time, what was the card that she was holding in her hand? Because if this is the card that she's holding in her hand, I mean, that would be crazy because you could have said any card, but you chose any card. What was the card that she was holding in her hand?
Changed about 4 times, but ace of diamonds.
Oh, you did change 4 times in your mind.
Yeah. Mm-hmm.
And you didn't change. When I asked you if you wanted to change here, you didn't change, but you chose that card specifically. You said the ace of diamonds was the one that you settled on? Let's see. Ready? No, the Queen of Hearts. Oh, that was close.
That was the first one I did think about.
That was the first one you did think of. You know why?
You
thought of the Queen of Hearts first because I said the lady dressed in red with the crown on her head. So that influence started to work. But then you thought, hey, he's trying to influence me. I don't want to be basic. I don't want them to think that I'm a Karen, right? So I'm gonna go for something random, right?
Yeah.
So you went for the what?
Ace of diamonds.
And I said there would be one card in her hand. That lady dressed in red with the crown on her head would be holding one single card.
What?
And that card was the ace of diamonds. Well, it's very small ninjas. You don't see them; they're so small they move around quickly. But that's the main principle.
That was cool.
Thank you so much, guys. Thank you. And now I'll finish off one last thing here. I always like to do this sort of towards the end of my show. This last thing is not a magic trick, so don't try this at home. This is dangerous. So please don't try to, not as dangerous as the spike trick, but a little bit more dangerous, in fact. I'll tilt this back just a little bit here. And I'm going to move my chair. And again, this is not a trick. So just know that this is not something that you want to give a shot with yourself. So these are 3 27.5-inch machetes. They're steel, they're dangerous, and I'm going to juggle them. Are you ready, Nancy?
I'm ready.
You do not look ready, but I think
I am ready.
I'll take one, I balance it on my nose, and it's gonna fall off. 5, 4, 3, 2, 1, just like that, and I start to juggle. Now this is a lot of practice. I can get up here on my day bed, courtesy of the Pottery Barn, okay? And I can go underneath my leg like this, or even underneath my leg like that. I can go behind my back, or even over the top and underneath the arm. And finally, I'll do the ninja move. Chelsea, could you just make your best ninja sound? Go ahead.
Yeah.
Oh, that was pretty good. That was pretty good. So on the count of 3, you make that sound, and I'll do the ninja move. Now I cross my arms like this. This knife does a double flip. While it's doing that, I spin them around like this. One goes over the top to behind the back. I catch it before it hits the painting. If you guys enjoyed this little set here, my name's Harrison Kramer, harrisonkramer.com. If you did not enjoy it, my name is Chris Angel. Okay, so here we go. Watch. Chelsea, on the count of 3, your best ninja sound. Go. 3, 2, 1.
Hiya.
Hiya, that was pretty good. Here we go. 1, 2, and. And there it is, guys. That's the show. Thank you guys so much for having me. It was a pleasure to be here. I hope it was one of the more interesting things that you've seen on a Zoom call, which I really hope it was. So thank you guys so much, and have a great rest of your day, and enjoy the rest of whatever you're doing today. Thank you.
Thank you.
Thanks, Harrison.
Bye, guys.
Thank you, everyone, for joining us today. Have a great rest of your day.